sir.
Hi, Cindy.
What is ventilator? What does it mean? If the person is in ventilator, is it mean he is not going to survive, or is it serious? What does it mean exactly, sir?
Okay, this is a very interesting topic. First, let's understand what is ventilation. What is ventilation in a house?
Oxygen supply.
No, in a house, ventilation means air coming in, air going out is ventilation. This is what we say. A house has good ventilation. That means air comes in, air goes out. Similarly, God has given mechanism in the human body where we can take in air, we can leave out air. So this is also called ventilation. We are ventilating the body. We take in air, we expire out air. So if a person cannot do it by himself effectively, then we will use the help of a machine to do this work. This machine is known as a ventilator. To be more precise, it is a mechanical ventilator. What will this do? If a person cannot do the work of taking in air and pushing out air effectively by himself, a machine can do it for you. This machine is a ventilator. So, if a person is on ventilator, what does it mean? There are basically three reasons. Broadly, I can tell three reasons why a person will be on ventilator. Firstly, if the lungs are not working, that means what is the function of the lung? Grossly we can say lungs takes oxygen and throws out carbon dioxide. If this work is not being, suppose there is injury to the lungs or some disease, lungs is completely damaged, it is not functioning properly, then the work of the lungs can be done by a ventilator. This is first use. Second scenario where we are sitting and we are talking, we are breathing. Suppose we are sleeping in the night, even then we are breathing. So even when breathing is such a mechanism where when you are conscious, we are doing it. Even when our consciousness is down, just the way in sleep, we are not fully conscious. Consciousness has decreased. Even then, body does not forget to breathe. Breathing still happens. But once the conscious to be able to breathe spontaneously also requires a certain level of consciousness. Suppose when a person is sleeping, if we try to wake him up from sleep, he will wake up. That is his arousable. Suppose that sleep he goes more and more, consciousness goes on decreasing, that even if you try to wake him up, beat him up, he is not waking up. This we call as comatose state. Patient is in coma. Such patients, breathing won't happen by themselves. Brain will be in coma state, in very deep coma, even the breathing will stop. In such conditions, since breathing has to be continued, the patient can't breathe by himself, the machine will do it for him. So see, this is the second scenario. First scenario is lungs are not functioning. Second scenario, brain is not functioning. That means consciousness has decreased so much that even body has forgotten to breathe by itself. And third scenario is known as elective ventilation. What is elective? The meaning of the word elective is I choose to put the patient on ventilator. It is a choice. When is it a choice? Many a times what happens when long surgeries are performed, say 6 hours, 8 hours, 12 hours, big surgeries are performed. And when surgery is performed, patient is given anesthesia and is made unconsciousness, and patient will anyways be put on ventilator. Artificially, breathing will be done artificially. After the surgery also, the anesthetist decides to continue the ventilation. They don't want the patient to immediately wake up. What happens after certain prolonged surgeries? This we see many times in brain surgeries or surgeries of the neck, spinal cord. Anesthetist chooses that let the patient not wake up immediately, because what happens if the patient wakes up immediately, there will be so much of pain after major surgery. There will be so much of pain response. Because of the pain, his heart rate will vary, his blood pressure will vary. We don't want all that to happen. So lot of pain medications will be given to suppress pain, and we will purposely make the patient anesthetized and sleep for the next 12 hours, 13 hours, so that body gets rest and pain is completely decreased and the breathing, heart rate, everything can be controlled. In such a patient, since we are decreasing the consciousness by ourselves, even breathing will be a challenge for such patients. So we'll have to artificially make him breathe. So to summarize, if a patient is on ventilator, it can be any of these three scenarios. One is lungs is not working, one is the brain is not working, or it is elective. Doctor has chosen that for as per his plan, he wants to give anesthesia medications, put him to sleep, and ventilate, and allow the body a certain recovery time. Once this pain decreases and patient starts waking up, gradually anesthesia effect will be removed and he will be taken out of the ventilator. And so basically, if a patient is on ventilator, it should not be taken as it is a death sentence. No. So many scenarios. So this is in brief about ventilator. So next time if you hear somebody is on ventilator, I hope you will have a better understanding of the situation.